is MRI scan of a 28-year-old male referred from the department of the psychiatric with the complaint of smiling, muttering, aggressive behavior, and a right-sided hemiparesis with no previous history of any trauma or accident. On MRI imaging, there is evidence of ill-defined white matter hyperintensity. This arrows mentioning the ill-defined white matter hyperintensity noted in the bilateral centrum semioval, periventricular area, and in the white matter of the frontal region. On T2 weighted image, it is appearing hyperintense. On FLAIR imaging, also it appears hyperintense. Ill-defined hyperintensity is also seen in the pons and the midbrain area. There is also evidence of mild prominence of the sulcogyral species, ventricular system, and basal system. There is hypoplasia of vermis is also noted. Hypoplasia of the vermis noted. After noticing all the symptoms and correlating with the finding in the MRI, white matter changes in bilateral periventricular region with the frontal region and the cerebral atrophy. Following possibilities to be considered. First one is the metachromatic leukodystrophy. Second is X-linked adrenoleukodystrophy, dandy vocal variant. Dandy vocal variant is less severe posterior fossa anomaly. That classic dandy vocal malformation characterized as a partial vermian hypoplasia with a partial obstruction of the fourth ventricle. It is considered on the lesser end of the disease spectrum in the dandy vocal continuum. Metachromatic leukodystrophy is a rare hereditary genetic disorder that causes the fatty substance like the lipid to build up in the cells, particularly in the brain, spinal cord, and the peripheral nerves. This buildup is caused by the deficiency of an enzyme that helps breakdown of the lipids called sulfides. The brain and the nervous system progressively lose the functions because of the substance that covers the protect the nerve cells. Myelin is damaged. Adrenoleukodystrophy is a genetic disorder connected to the X chromosome. It affects the nervous system and the adrenal gland. Symptoms of the adrenoleukodystrophy often include the behavior and cognitive changes. Adrenoleukodystrophy affects the males more than the females. So there is a possibilities of these three things.